share the slide. Yeah. Thank you very much for giving me this opportunity. APPI Belgaum, KLE Academy of Higher Education and Research, Jawaharlal Nehru Medical College, organizing chairman Dr. Sunil, organizing secretary Dr. Harpreet. I am Dr. Hanjabam Barun Sharma, the president of Indian Society of Sports and Exercise Medicine, Sports and Exercise Medicine specialist, as well as medical and clinical physiologist. Let's begin the talk. Bones, just like any kind of the tissue, they adapt to physical activity, and it is determined by the strength. That is the formation of the bone tissue with the muscular force imposing the largest strain on the skeletal muscle system during the voluntary activity, especially during the weight bearing activity. And based upon the three important principles, which are known as Professor Charles Turner three rules for the bone adaptation to mechanical stimuli, we generally prescribe the exercise. These three rules are number one: bone adaptation is driven by the dynamic rather than the static load, that is cyclically, not the continuous one. Only a short duration of the loading is needed to initiate the bone adaptation, and the bones will accommodate and they become less responsive to the routine loading. So depending upon these three rules, different exercise prescription, exercise design we can do by following the principle of the FITT: frequency, intensity, time, and the type. Short frequent bout of the weight bearing exercise can be done daily or multiple times a day. Intensity has to be high impact exercise or high strength from the muscle on the bone should be there. It can be of short duration, 5 to 10 minutes or less, separated by the rest duration. And the type of the activity include a multi-directional irregular loading pattern containing surprise element are more effective as compared to the exercise involving repetitive routine strength pattern. So this one has to understand. And and one has also to understand certain physiological basis for the bone adaptation. Like for example, the key load sensing cell is the osteocyte, which sense the bone strength, that is the formation of the bone tissue by the change in their environment. They sense it, and after that mechanotransaction happen, that is the bone, they basically convert the biophysical force into cellular response by initiating different key cellular signaling pathway, and also by what is known as the mechanostate feedback system. There occurs the adjustment in the bone mass structure depending upon the mechanical stimuli, and everything has to be so that the bone has to stay within the physiological window. That means pathological abnormality doesn't occur, and this mechanotransaction by using the mechanostate and this adjustment can be done with physiological limit, and stretching of the physiological limit can happen leading to the adaptation. That means the adaptation of the bone mass structure and strength can happen in order to match the functional demand. So this type of the concept is very much important in order to understand. That means if there is if there is a type of the load which is steady state signal, then what will happen? Accommodation happen. That means switching off of this sensation can occur, and bone adaptation fails to occur. That means in absence of varied stimuli, the bone cell desensitized to loading. That means if you want to prescribe an exercise program, you have to vary the type and the nature of the exercise in order to ensure the continued response of the bone mass for the optimal bone adaptation. So if there is no stimulus, then what will happen? If there is no stimulus, then bone loss will be there. Like for example, bed rest. Bed rest is very much commonly given after say any kind of the injury, but in the world of the sports medicine, bed rest is always discouraged. You complete rest is never given. It is always a relative rest or optimum loading, because the bed rest is approximately associated with a 4% of the bone loss per month, and a reversal of this loss it takes a relatively longer time. Therefore, it's always better to avoid a prolonged bed rest. And this is the same principle we have already talked about. And regular walking and a low intensity exercise, they are not sufficient, because they are not they are not that type of exercise which is important for the bone loading. In fact, high and the odd impact loading, they are very much beneficial, and they have a greater bone mass. They result into greater bone mass and superior bone structure, and that beneficial effect of such activities, such participation in activity, such sports participation, especially when the training start during the childhood, it remains till retirement in the middle age or older athlete. That means if you participate in gymnastics, soccer, tennis, squash, and all those weight bearing physical activity and sports, then their effect remains till your older age. And the base exercise, base form of physical activity, base form of loading is always high strength magnitude. It should have the high strength magnitude. The high strength rate should be there, and the strength should be such that the bone are not normally accustomed to. That means a fewer loading cycle is necessary. You don't have to continuously repetitive load it. Just fewer loading cycle is important. With what loading bout is broken with a rest interval in between. That means rest should be done a short frequent bout with a rest interval. So this is the ideal type of the exercise which one has to understand. Just similarly, in one of the study this they have done, they have just incorporate 10 jumps 3 times a day when the school bell rang. School bell rang, they have basically they are breaking this load into smaller bout, that is 3 times a day, 10 jumps into school curriculum, and they have found that there was improvement in the bone density. So in this way, such exercise design, they are very much effective for bone adaptation. So why this is important? Because the bone there is the response of the bone mass with increasing age. This is the bone the curve. You can see that this green line is male, and this is orange continuous line is for female, and dotted red line is for the osteoporotic, that is pathological condition. And you can see that around at this point, that is here, you can see that the linear gain is there. That is more than 25%, that is 1/4 of the adult bone mass gain occur during say 11 to 13 years of age. 11 to 13 year of age in case of the girl, 12 to 14 year of age in case of the male. And the peak, see the peak density and the strength, they generally reach by the end of the adolescence, or the peak bone mass is on an average around 15 to 17 years in case of the female, or 16.5 to 18.5 in case of the male. That is around 18 years or so. And after 40 years, you can see that there is decrease happen, and this decrease in bone mass can be 0.5% per year also. And you can see that around 20 years or so, bone mass size and strength, there is basically a plateau out. Plateau out is there during the late teens and early 20s. So this concept is very important, because after understanding this graph, you will understand when exercise intervention has to be given for it to be very effective. For females, it's very much important, because osteoporosis is very much common in case of the female, especially after menopause. And you can see that the women generally attain the peak around say 20 years or second decade of life, and from here till menopause there is relatively little losses there. But in menopause or just after menopause, for a few years, you can see that the decline is accelerated, and this decline can be as high as 5% per year. And then after few years, there is this rate of the loss slows down. And you can see that if you incorporate exercise intervention during the pre-pubescent time, during the pre-pubescent, during the pre-pubescent, then it was found in one of the study that such girl, they gain twice as much as bone mineral content, BMCA, as compared to those girl where similar exercise intervention was given after the puberty. That means you know that golden period where exercise intervention has to be done. So in general, the peak 90% of the peak bone mass occurred by the age of the 18 years here, approximately by the age of the 18 years, 90%. And the critical window is always pre and early puberty. That is, exercise intervention has to be given around pre and early puberty. That is, childhood and adolescence are the crucial time where adoption of the lifelong behavior, including physical activity, is very much important, and this will lead to the prevention of the osteoporosis later in the life. So based upon this principle, we can design exercise prescription based upon FITT principle, like we have already talked. Like for example, adolescence and adult. In case of adolescence, the type of the exercise can be say high impact gymnastics, plyometric and jumping and all these things. Moderate intensity resistance exercise can be given. Participation in sports which involve running and jumping, like soccer, basketball and tennis. For adult, weight bearing endurance activity can be done. Jogging intermittently during walking or stair climbing. Tennis also an activity which involves jumping and resistance exercise. It can be incorporated. They can be given say 3 times per week. For adult, it can be 3 to 5 times per week for weight bearing endurance activity, aerobic activity for resistance. 2 to 3 times per week. Intensity can be of high bone loading in order to be effective, but for safety reason it can be less than 60% of the 1 rm, that is one repetition maximum amount of the weight which you are able to lift, say only one time by maintaining all the form, that is 1 rm. And moderate to high intensity can be given in case of the adult in terms of bone loading force, and such activity can be of 10 to 20 minutes, or it can be more than or twice a day are more effective, more than one time. In case of the children and adolescents, for adult it can be of 30 to 60 minute per day, which composed of various combination of the activity. So similarly, various research they have incorporated the different type of the program, like for example action school BC ASBC, school based physical intervention with the bone loading component. That means what they have done is 3 times 3 minute of jumping activity, which are also known as bounce at the bell, 4 times per week for 16 months, plus 15 minutes of per day of the physical activity like skipping and weight bearing activity are incorporated. They found that there was increase in bone mass and strength at important site, like for example say a lower lumbar spine, or say what do you call the femur, the femur neck of the femur, or say the tibia and all these things. And you can see that this was done in the British Columbia and Canada, and you can see that for the best exercise for the bone mass and strength is always short bout of high impact physical activity during the adolescence. So we should not miss this opportunity, this physiological opportunity. So going ahead with the muscle also, there is also loss in muscle and muscle strength. Muscle for both male, and this is the male graph, this is the female graph, and this is known as sarcopenia and dynapenia. Sarcopenia is a loss of muscle mass, so, and dynamenia is the loss of the strength and power. It generally begins around 40 years, detectable around 50 years. The rate can be 0.8 to 1% per year of muscle, or 0.5 to 1.2% per year. Or for strength or power, the loss can be 2 to 3% per year, or it can be up to 3% per year. And up to 2.5 to 30% of the older adult, they are found to have low muscle mass. That means the sarcopenia is very much common, and sarcopenia we have to fight the sarcopenia along with the the decline in the bone mineral density. This one has to understand. And this loss of the bone muscle mass can occur in different type of the pathological condition, like for example incomplete recovery can happen in older individual, or chronic muscle wasting condition like rheumatoid arthritis, renal failure, type 2 diabetes, even COPD, cardiovascular disease, or say rapid muscle wasting can be done in case of the critical illness, sepsis, burn, and end stage renal failure. All this can lead to the rapid muscle loss. But what is important is if you incorporate resistant exercise, if you incorporate impact loading exercise, if you incorporate the sufficient high protein, good quality protein, nutrition intervention, then what will happen? This loss in the muscle mass can be prevented up to some extent. This concept is known as the muscle-centric medical approach, MICMA, MCMA, that is clinical and physiological intervention with the use of the optimum, evidence-based exercise like resistance training, high-intensity interval training, or high load impact loading exercise, nutrition, lifestyle, and other clinical physiological intervention, focusing on muscle health and fitness. For what? For good quality, high quality, longevity, and overall health. This is known as MICMA, that is muscle-centric medical approach. This is important nowadays, because we have always traditionally focusing only on the fat-centric approach, obesity. But sarcopenia is also very important. So muscle-centric medical approach is the one which we have to adopt. Why this is important? Because more than 65 years of age, adult, 30 up to 33.3% of fall will occur at least once a year. For more than 70 or 42% fall can occur at least once a year, and 94% of the hip fracture is because of the fall. And 20% of the such hip fracture are fatal. That's why we have to incorporate physical activity in the form of the strength and balance exercise. Very important, in addition to the regular aerobic and the flexibility exercise. This one has to understand. So based upon this thing, we can design different exercise prescription. Like for example, resistance and balance exercise frequency, it can be say equal to more than 2 days per week, and with the 2 days or 48 hours gap between the training session for the same muscle group. For balance, it at least 3 days per week. For intensity can be 60 to 70% of one arm. There is moderate intensity. You can aim for higher also. But for the balancing, it has to be challenging. It has to be challenging, but not exceed the functional capacity. Otherwise, injury can happen. The time the recent exercise can be say at least one set. Should be more than one set, equal to more than one set of 10 to 15 repetition, and consisting of 8 to 10 exercise composing targeting major muscle group of the body. 2 to 3 minute rest between the set can be given. For balance exercise, can be equal to more than 10 minutes. Type of exercise: resistance, calisthenic, free weight, and stair climbing, and all these things. Balance exercise like yoga, Pilates, and Tai Chi. All these things can be done. In addition to the aerobic exercise, like done at least 5 days per week. Moderate to vigorous, that is 64 to 76% to 77 to 95% of the heart rate maximum. You can calculate the heart rate maximum by using the formula of say 208 minus 0.7 into S in year. For the intensity of the flexibility, you can stress the flexibility up to the point of the discomfort, up to the point of the tension, but never to the point of the pain. So a relative discomfort is allowed, but severe discomfort or pain is not allowed. And the aerobic exercise can be a duration of 30 to 60 minutes per day, or 150 to 300 minutes per week, or flexibility 10 to 30 seconds. And the aerobic cycling, walking, swimming, dancing, jogging, all these things can be done. Cycling and swimming, they are non-weight bearing exercise, which are not so good. If you see as far as bone is concerned, walking also not so good. You have to do high impact exercise. For flexibility, static and dynamic stretching exercise can be done. Yoga and Tai Chi and all these things can be done. So, and also for an elderly population, you can assess the gait also. The speed of the walking is also important. Like for example, 3 kilometers per hour is the limit. If limit for what? Prediction of the mortality. If it is less than 3 kilometers per hour, then it is very much severe. So you should aim, the elderly population more than 70 years, they should aim for at least 5 or 4.9, equal to more than 4.9 kilometers per hour for the walking speed. That means if the walking speed is more than 3 or 2.9 kilometers per hour, then 20% less likely to die. So by just by seeing the speed of the walking by gait mechanism, you can predict the mortality and the morbidity in elderly population. Different program has been published, like for example OEP, there is Otago exercise program, where home-based strength and balance exercise was given, and it was found to be 35% reduction in fall reduction was there, especially for more than 80 years participant. Lifestyle integrated functional exercise, where balance and lower limb strength training was incorporated in the daily routine. It was found that 30% reduction in fall was found. So these are very much important. So going ahead with the osteoporosis, you can see that exercise is very much important for the prevention as well as treatment of the osteoporosis. Like for example, if an exercise can be considered to be effective in osteoporosis only when in the DEXA you find that there are equal to more than 2% change in BMD, that is bone mineral density. It has to be changed more than 2%. Then only you can see that that particular exercise is effective. For DEXA scan can be done in order to diagnose the osteoporosis. Like for example, T score, it is generally it is less than minus 2.5 standard deviation, which is as compared, T score is basically compared to the average 30 years. But this is basically not used for individual who have not reached the peak bone mass. In those younger individual, we can use the Z score also, where the comparison is basically done to the same healthy same age group. The role of exercise for the adult is always maintenance and maintenance. That is maintenance of the adult bone mass and strength. For younger population, for adolescents and childhood, what was the aim? The aim was to have a higher peak mass, peak gain. The gain should be high. But in case of the elderly population, in case of the older population, it is the maintenance, and the gain is very much small. That is approximately 1 to 3% gain can be done in the bone mass and strength. But this, even if it is small, there is only 1 to 3%, but it is sufficient to reduce the fracture. And what type of the exercise we have to use? Moderate and high impact weight bearing activity and high intensity resistance training are very much useful, as we have already seen. And there are different type of the exercise, like for example high impact loading exercise. We have to understand what are the impact loading exercise, what are this type of exercise. So impact loading exercise, they are basically the vertical and the multi-directional jump, different type of jump, hopping, skipping, drop jump, band stepping, and and all this thing can be done. And you can in fact design the progression also by increasing the height, say by using weighted base or changing direction and all this thing. And this impact loading can be used between the balance and rest and exercise. And this impact loading can be divided into high impact, moderate impact exercise. Like for example, high impact is when the impact is more than 4 times your body weight. Like for example, vertical, high vertical jump, star jump, tuck jump, drop jump, and the different sports, volleyball, basketball, gymnastics, and all this thing. It is considered to be moderate when the load is 2 to 3 times your body weight. Running, stripe, jump, jump rope, and all this thing, different type of sports, racket sport, track and jump, all this thing, martial art we have seen. And for moderate to high impact exercise, it is more than 2 times your body weight, and it includes all the activities which are in high impact and moderate impact. So in this way, exercise activity can be divided based upon their the force, the loading, the amount of the loading. Like for example, this is they are the different type of the impact loading exercise. Jumping exercise, plyometry exercise, different type of jumping exercise incorporated in the martial art. You can see that sports specific martial art, different type of the jumping. And running also can be of the impact exercise. Why running, not walking? Why? Because vertical ground reaction can reach up to 3 times or your body weight if you are running at the speed of 25.2 kilometer. If you are running at a speed of 7.2 kilometer per hour, it can be up to 1.5 times your body weight. So running is always associated with 2.2 times your body weight as a vertical ground reaction, which is more than 2 times that of walking. So running at high speed can be considered to be one of the impact exercise also. And apart from the running, we have to understand a different type of resistance exercise also. Different type of resistance exercise is also important. Like for example, 8 type of resistance exercise we can incorporate targeting different muscle group: hip, joint, knee joint, ankle joint, ankle joint, abdominal, deadlift and squat, and all this thing can be incorporated. And progression can be designed depending upon the individual, depending upon the principle of the progressive overload principle with sufficient recovery, plus principle of the individuality and all the principle of the exercise training. Like for example, progression can be done say 50 to 60 to 80% of the 1 RM for the first 4 sessions. Why? Because in order to make sure that the correct technique is learned and the appropriate muscle conditioning happen, otherwise injury can happen. So intensity and the progression can vary depending upon the particular individual fitness level or risk level. This we have to understand. Like for example, in this study, you can see that as compared to blue is the control. This is the case where exercise intervention was given for 18 months, twice a week, equal to more than 85% of 1 RM for 30 minutes, 5 set of the 5 repetition. These are different exercises like deadlift, overhead press, back squat, jumping, chin up with a drop landing. All this exercise was given in the 65 plus minus 5 years in case of the female. And you can see that as compared to the control, who is the blue line, the percentage change was highly statistically significant in a positive direction. And this is for the lumbar spine bone mineral density. This is the femoral neck bone mineral density. That means rest and exercise, high intensity, superior, high intensity rest and exercise and impact exercise is very much useful as far as prevention of the bone mineral density loss is concerned. So apart from the rest and exercise, we have also to understand the balance exercise. Balance exercise and flexibility exercise also we can incorporate. Balance exercise can be standing or moving exercise with a gradual reduction in the base of the support in order for the progression. Like for example, standing only on the one leg, or say leaning to a particular direction, or reaching to a particular target, or minimum use of the upper extremities can be tai chi and all this thing. A figure of 8 walk, tandem walk, a sideways crossover walk, walking or on an uneven surface. All these things can be incorporated. And progression can also be done by further reducing the base of the support, or say faster step, heel toe work, withdrawal vision. You withdrawn the vision, that is blinding, or say during balance tasks, dual tasking, that is by cognitive tasks like counting backward or naming animals combined with the balance activity. All this thing, by using all this thing, we can progress the balance exercise, because principle of progressive overload is very much important in order to have a continuous adaptation. This one, because we cannot give exercise which is static, continuous. Instead, we have to follow the principle of the progressive overload. This one has to understand. And exercise can be challenging. Sometimes, exercise has to be challenging. What do you mean by exercise challenging? Challenging means it is an exercise. It is a level where attempt can be done, but that particular exercise has not yet been mastered. That means the entire time, distance, or activity cannot be completed without losing balance. That means it is known as challenging. It should be challenging, but it should not exceed the physical functional capacity also. Otherwise, injury can happen. So this is known as the exercise should be challenging. It should not be challenging, because if you continue challenging, then the progression is there. Then more adaptation can occur, because you have not mastered that level. If you have not mastered that level, then that level is known as challenging, because you are attempting that in that particular level. So different type of the balance exercise is very much important, and these are the part of the different martial art, different sports. So different type of the balancing act is very much important, and flexibility training is also important. You can incorporate different type of flexibility training also. So based upon the RxEx exercise, training has to be given in case of the osteoporosis, and that's why RxEx stratification or RxEx classification is very important, because if you give a very very high load exercise to a particular person who is at a very high risk, then injury can happen. So that's why level of the risk for exercise prescription is very important, which are based upon the current bone health or bone mineral density by DEXA scan, or fall or fracture risks. Like for example, there are different risks is considered, like for example, age, frailty, sarcopenia, family history of osteoporosis, family history of fracture and fall, back pain, mobility, vision issues, and all these things. You have to take all these things into consideration. So what do you mean by low risk? Low risk means the person is asymptomatic. It has a normal bone mineral density. That means T score should be more than -1 standard deviation. Functional status is normal, functional well in the daily life, and there is no clinical risk factor for fall or fracture. For a moderate risk, that means there is a low bone mass is there. T score is between -1 to -2.5 standard deviation, plus certain clinical or functional risk factor for fracture is present. And what do you mean by high risk? High risk means very low bone mineral density or bone mass is there. That is T score is less than -2.5 standard deviation, or osteoporosis. These are technical definition for osteoporosis. Presence of previous fracture and or multiple clinical or functional risk factor are present. So these such person are known as high risk. So depending upon the risk level of the risk, you can design a particular exercise prescription. Like for example, let's talk about the low risk and moderate and high risk for an impact loading exercise. Impact loading we have already talked. So in case of the low risk, the frequency can be 4 to 7 days per week. In case of moderate, same. High risk also same, because in high risk such exercise prescription can be used for management, not only for prevention of fall but management. But in moderate and low risk, prevention of the osteoporosis. Time and character, high impact, it has to be high impact, that is more than 4 times of your body as tolerable. And you can use moderate to high impact, that is more than 2 times your body weight for moderate risk. But for a high risk, moderate impact, 2 to 3 times your body weight within the pain limit, within as far as tolerable limit, you can use. And for time and character, the 50 jumps per session can be done, say 3 to 5 sets of 10 to 20 repetition with 1 to 2 minute rest interval between this thing exercise you can design. For moderate risk, 50 jump per same thing you can design for a moderate risk with 3 to 5 set can be done similarly. But for a high risk, you can aim for up to 50 repetition over the time. Over the time you have to aim. A 5 set of 10 repetition with 1 to 2 minute rest between rest interval between. So in this way, you can incorporate the exercise prescription for high risk. Another important point which you have to understand for high risk is, you have to aim that particular person participate in multi-component exercise. You should not restrict a particular exercise, that particular individual to only one type of exercise. Multi-component exercise should be there. It should incorporate resistance exercise and balance exercise. Balance exercise are also known as proprioceptive exercise. Balance and proprioceptive exercise. The combination of the recommended by WHO and all American College of Sports Medicine and all the international body, they have given recommended physical activity. So recommended aerobic activity, say 150 to 300 minutes per week of moderate intensity, or 75 to 150 minutes per week of vigorous intensity aerobic activity need to be incorporated with balance and strength training as recommended by WHO and other international body. So this we should aim in order to achieve at least the recommended activity for the high risk group with the multi-component exercise program. So let's talk about the resistance training for a low risk, like same thing, low risk twice 2 days per week. Intensity can be high to very high. That is 80 to 85% of the 1 RM. We can, and if you see the RP, that is a rating of perceived exertion for a Borg scale, equal to or more than 16 Borg scale can be targeted. Time and characteristic, characteristic of this exercise, it can be, we can target 2 to 3 set for 8 repetition. Can include high velocity rapid resistance training. We can include for muscle power and muscle power and muscle functioning. You have to incorporate such type of activity. You have to follow the principle of the specificity, specific demand, specific adaptation to the imposed demand, SAID principle. So avoid deep forward spine flexion, because low back pain and low injury can happen. Proper technique is very important. Proper technique and the exercise should be done under the supervision. Similarly, for moderate and high intensity exercise also, same thing we can do, the similar thing, all these things we can do. But the point which you have to understand for the high risk and moderate risk is individuality, principle of the individuality you have to follow. Like for example, you don't have to do start with the high intensity, so you can, the intensity can be mild to moderate, and then slowly we can build up. So always you follow the principle of the progressive overload. You always start low and go slow. Go low, go start low and go slow. Slowly you can build up. So all these things can be incorporated for a moderate risk and high risk, depending upon the requirement. The rate of the progression resistance exercise we have already talked about, depending upon the principle of the individuality. Depending upon the percentage of the 1 RM, we can progress. For the first session, always slow progression is there. Why? Because we want to use the correct technique is very important in order to avoid injury, and appropriate muscle conditioning in order to learn that. You have to wait for some time. Then after after proper technique has learned, after say proper conditioning has occurred, then you can slowly build up. So depending upon the individual risks in each category, then progression can be done. Similarly, for the exercise, for the balance exercise, you can see that for low risk balance exercise activity, you have to incorporate with the strength and impact element of the exercise. Balance training can be incorporated. That these are tasks can be performed with the eye closed. But you should do in nearby to a railing or some secure support, because in order to prevent any kind of the fall. So challenging intensity of this exercise has to be challenging. Similarly, for moderate and high risk group, the frequency of balance can be of say for moderate and high intensity 4 sessions per week. Similarly, for high risk also, and intensity can be challenging. What about the characteristic of that type of exercise? 30 minutes of the balance exercise can be at least 10 seconds of duration of the balance exercise can be done per one balance exercise. At least 10 step forward and backward for mobility exercise. Step exercise you can do, increasing tolerance as per tolerated for a longer duration. Slowly from 10 step you can go further. Then it can be accomplished within other exercise. This balance exercise has to be incorporated within rest and exercise, and aerobic exercise. We can incorporate it during the course of the week. Slowly we can incorporate as part of the as part the fitness level increases. And the tasks can be performed with the eye closed, but when you do such type of tasks, then it has to be in proximity to a railing or some secure support. This thing one has to understand. And for a frail individual, in case of the high risk group, then supervision, everything has to be done under supervision. So exercise should be done under supervision to prevent the fall when performing any kind of the balance exercise. Activities should be within the reach of the secure support like rail or all these things. So this type of the exercise, this type of the exercise session one can do. depending upon the different type of the FITT principle or the principle of the exercise training. This one has to understand. So let's come to the end of my talk. That means exercise training is very much important. It is not only important in order to achieve the peak bone mass when given along with the nutritional intervention in the pre-puberty or pre-adolescence phase, uh, in order to achieve that peak mass. And when the exercise is given in the elderly population or adult population, then we can fight the age-related decline in bone mass, age-related decline in skeletal muscle mass, as well as muscle strength. So exercise is very much important, not only for the prevention of the osteoporosis, but also for the management of the osteoporosis in the high risk group also. So one has to always understand the importance of the exercise. Like for example, this female, you can see that her name is Ernestine Sefford. She is the oldest competitive female bodybuilder, 70 years of age. So which one you prefer? It depends upon your choice. So your lifestyle has to be, active lifestyle has to be there. And here you can see that this is a 40 years old triathlete, cross section, of the thigh area, there is leg, and this is the adipose tissue, fat, the adipose tissue, shrinkage of the muscle. There is sarcopenia is happening in 74-year-old sedentary person, but 70-year-old triathlete, you can see that they maintain the muscle mass. That means not only muscle mass, but the bone mass also. So exercise is very important. So physical activity, exercise, and positive lifestyle has to be incorporated in such a way that positive physiological adaptation happens by following all the principle of the exercise prescription, by following all the principle of the exercise training, scientific principle, so that this positive adaptation occurs, and it will lead to the performance, human performance, sports performance, fitness, as well as health. So this one has to understand. Thank you very, very much. If there is any question, you may ask me. Thank you very much.